What's up, everybody? Colleen here of Co-Create, and today we're talking about sitting. So, as some say, sitting is the new smoking, but we can't get around it. We may be sitting for our job, we may be commuting long distances or sitting in traffic like we are here in San Diego, and we just can't avoid it. So, how can we help our bodies be at ease and at rest as best as possible, but also being in best alignment? This is going to be super important if you're pregnant and if you're healing postpartum. So we live in a couple different orientations. So if we have an anterior pelvic tilt, that means our pelvic bowl is tipping forward and we have more of an extreme arch in our low back. We may have an extreme arch in our low back. And this is those club booties. If you are a gymnast or a dancer or a lifter, you may have this. If unfortunately sticking out your bum is reinforced in cultural norms, there's a whole bunch of stuff that goes into this. But if you are living in this orientation, this can also be just pure genetics and how your body orients against gravity since you were a baby. Totally cool. But we're bringing awareness to it, because if you're pregnant or postpartum, you having an anterior pelvic tilt means stuff is falling out. So this could be your organs, your fetus and placenta. Things are constantly being tipped forward. Then we can have the opposite. We can have an posterior pelvic tilt. And this is that tucking under, and we usually see a rounded back. So this is that typical like desk posture that we see. And what this orients to with all of your stuff in your guts and your trunk is everything is folding in on itself. Then we have our last orientation, and that is neutral, which we are all going for. So we have a more neutral posture, and then we have a slight arch in our low back, and things are stacked. Our guts and our organs and our fetus and placenta are all being stacked downward, and our body loves to be stacked. We should have a pelvis that's stacked over our feet, that has a rib cage that's stacked over the pelvis, and our skull should be stacked over our rib cage, but we have text neck, so we want to get super sexy with double chin time and get heads back so that we can have a neutral cervical spine. That's all crazy stuff that we'll talk about in a future video. For right now, we're talking about sitting. So during pregnancy, if our fetus and everything is tipping forward, that means that we have to do a lot of work to pull it back in. So we're pulling all of the stuff back in. That's a lot if we're living in that space, and then when we go to give birth, we're oriented backwards when we really want to be oriented down. We want gravity to do as much work during labor and delivery as possible. But if you haven't been living in a neutral during your whole entire pregnancy, it's going to require more effort and more work. You, thankfully for spinning babies and tips and tricks from those in L&D, they can help you pull everything back in and orient yourself in your pelvis and move to help that delivery go smoothly. But if we can put the work in now to be in neutral and help our body orient this way, we're going to be a lot better off. The same thing for having this posterior pelvic tilt. Think about this as everything is getting compressed. We have compression of not only like our organs, but then we're not allowing the baby or babies to move and wiggle, and potentially they get stuck in some type of orientation because they don't have room, when we want them to have room to always go head down. And then here in neutral, hopefully we're creating enough space and optimization for babies to go head down and do their thing. But as long as we can keep getting in our neutral as much as possible with these two things that we may have lived in before, we are creating a general sense of overall balance and well-being, and then space for everything to do its thing for babies and for you. So my best recommendation, the easiest thing that you can do is take a towel, be it a hand towel or a small towel, and you are going to put it under your bum. In our pelvis, we have these two most southern prominences called our sits bones, as you will, and we can literally, if we got junk in the trunk like I do, I have to lift my glutes up so that I can sit tall on these sits bones. You will feel them. If you're sitting on a hard floor or a hard chair, you can feel what it feels like to sit on your sits bones before you put a towel underneath, because that is going to be your neutral. That is your pelvis bowl being in your neutral alignment. And what this is going to do is it's going to do all the work for you. You don't have to worry about getting into neutral all the time and thinking about it 24/7 when you got other things to think about. I am giving you a tip and trick so you don't have to think about what your pelvis is doing. You just have to think about what your other top of your body is doing. But one thing at a time. So a towel under your bum so that it is doing the work for you to put you in neutral. The worst thing are car seats. Not car seats for kids, car seats for adults. Because they reinforce this position, this hunched forward position, because that's unfortunately how a lot of our culture's spines live, and they're doing the best to be comfortable and protective. So when you put a towel under your bum in your car, you may never touch the back of your seat because it is your neutral. The car was not specifically designed for your spine. So I highly recommend getting a lumbar support to support your natural curve of your low back, and then maybe your shoulder blades or upper thoracic will touch the back of the seat at that point. And when you're driving in the car, practice your sexy double chin tucks to allow your cervical spine to get back into neutral as well. Because there's a whole host of issues that come from text neck for kids and teens and adults. It's so much weight. Remember we were talking about stacking? Everything that's not stacked is causing strain and pull on your body. So if we can get into neutral in positions that we're living in because we have to, like for work and for driving, let's give our bodies what it needs, the tools. We can use tons of things to help it live better and live optimally, especially if you're pregnant. Postpartum, on the healing side, if you are living in a crunched forward position, you are not allowing any like DR to come together because you are literally like crunching all of that stuff together in a non-optimal, healthy way. The same thing here. If you're super stretched out, this can be putting a lot of pressure for like incontinence or POP, pelvic organ prolapse, or just strain on your tissues that are already stretched out from pregnancy. Everything is trying to come back together. And if you're living in an extreme position, you're not going to allow tissues to heal in the best way possible for you. This means that you may be at more risk for injuries and just aches and pains and issues, which nobody has time for. So get yourself into neutral as much as possible and use tools needed for anywhere that you're sitting. Have one at your desk, have one in your car, because your body will definitely thank you for it. If you have any comments or questions, please leave a comment below or hit me up through email, but I would love to hear from you. Have a great day.